My name is Obi Ekwanna, Dr. Ekwanna. I am a faculty here at the University of Toledo. I am a transplant surgeon, primarily transplanting kidneys into patients who have kidney failure. I also practice urology here and take care of patients with urologic diseases. I have been at the University of Toledo for about 4 years now, and I also teach residents and do some research and teach students as well. I will, during this interview, we'll be talking obviously about COVID-19 and its effects on or how it's impacting transplant patients and patients who are awaiting kidney transplant at the University of Toledo, and what we've been doing over the past, I guess, month and a half since the pandemic hit our region. So, definitely kidney disease is a risk factor, especially patients who are receiving hemodialysis. So patients on dialysis are at increased risk. Obviously, some of the comorbidities associated with kidney failure or kidney failure in general, hypertension and diabetes, have been shown to be extremely important in patients, or as comorbidities or risk factors for patients who end up developing COVID-19. And that's been well documented and illustrated, unfortunately, in what we see around the country. I think just as we've all been listening to the infectious disease experts and the national task force, the state task force, and what the governors of most states, and including our state here in Ohio, have been stated, which is to maintain adequate hygiene, hand washing, obviously, social distancing, staying at home if as much as possible, and obviously avoiding contact with individuals that may have COVID without knowing, and obviously taking extreme precautions for patients who are undergoing dialysis. I believe that the dialysis centers are taking extra precaution now, and as we know, especially in our area, our field, among those who take care of kidney patients or patients who have kidney disease, these patients already know that they have to take extreme caution in terms of infection control. So there's nothing new per se for most of our patients, but I think due to the heightened alert and due to this pandemic, we have emphasized really making sure that our hands are clean, making sure we're wearing masks, making sure we're, maintaining physical distance from others to avoid this unfortunate infection. I will say that as a transplant surgeon, during this period, patients that are receiving a kidney transplant here at the University of Toledo, recently we've been able to test these patients for COVID prior to transplantation. So what does that mean? A patient that is being called for a kidney transplant will undergo COVID testing. And if they are negative, then we'll proceed and transplant them. If they're found to be positive, we will, out of precaution, not transplant them, obviously, because we don't want to worsen their disease. Um, so um, so that's how we are approaching some of the pre-transplant patients. So those patients um, who have kidney failure that are needing transplant. It's a great question, and I think like most hospitals, the University of Toledo, where I practice mostly, and some of the other centers that I work at around in Northwest Ohio here, have gone to you know I'll say almost to only emergency surgeries or emergency care. And so we have been affected in a significant way. And obviously, out of precaution, out of the abundance of precaution, so that we are ready to take care of patients who have gotten infected. Obviously, as I said, only essential surgery or emergency surgeries are being done. As a transplant surgeon, when organs are available, we assess the need to transplant those organs balanced with the risk of um, um, exposure to not only our patients, to ourselves, and to our staff. And so we balance that risk, and we have continued to perform kidney transplants here. Um, you know, obviously, um, taking extreme precaution to make sure that we don't um, infect ourselves or infect our patients with COVID. Because at the University of Toledo, we've had um, a number of patients who are being taken care of with COVID. And obviously, they are being taken care of in COVID floors, but there's still a risk there. Well, a living donor is not necessarily at a higher risk of um, COVID-19. But we are not doing kidney during this period. We've as an institution, we have abstained from doing living donor kidney transplants. Just as you mentioned, there is a risk of bringing someone into the hospital that has no medical problem, which is a donor, and that person could contract COVID at the hospital, right? And so our first goal is really to try not to harm our donors. And, the donors are put themselves at risk by undergoing a procedure that they are doing for the sole purpose of really helping their family member. So, we have decided that the risk is too much to bring a donor into the hospital just to donate a kidney at this point. But from a just a general standpoint, most donors don't have high blood pressure, they don't have diabetes, they don't have lung disease. These are pretty healthy individuals, so they're not at higher risk for COVID, if that makes sense. But they could be at a risk if we brought them to the hospital to perform, an operation on them. So we have, as an institution, and most transplant centers around the United States and across the world have stopped doing live donor transplantation during this period for those reasons. At this time, no. Um, Again, out of the abundance of precaution, those organs are not being utilized because we are testing donors, so deceased donors, or we test those donors for COVID-19 prior to accepting those organs. There's not a lot of data yet on that, but suffice it to say, we are trying to, out of the abundance of precaution, not transmit COVID-19 um, to our recipients. And I will say this, that um, patients who are immunosuppressed, which when a person received a kidney transplant, they will have medications given to them so that their body does not reject the kidney. And so when you give these medications that sort of curtail the response of individuals to infection, this could be detrimental to their health. Obviously, if they contracted COVID or any other infection, correct? And because we don't have um, a standard treatment yet for COVID-19, we are not, we're taking, again, extreme precaution not to put our patients at risk for, for contracting this virus. So one thing currently here, things are beginning to reopen. So some of our elective surgeries are being done again. We're beginning to entertain the idea of having patients come back to, come in to be seen. We've been utilizing telemedicine quite a bit to evaluate patients. Um, and I think that will continue to be a tool that will be utilized more and more in terms of evaluating kidney patients and patients who have undergone kidney transplantation. Um, and we're hopeful that vaccinations will be started once some vaccines have been developed and tested. So hopefully that's in the future. And as you know, kidney patients, we encourage them to receive vaccinations for the flu, and we'll continue to encourage our patients to get flu vaccinations because the flu is still going to be part of what we have to deal with come fall and when the fall comes. So vaccinations are encouraged, and hopefully there'll be vaccines developed. There are some promising medications to sort of treat this infection that are being tested. Some antivirals and some other medical therapy. So those things are in the pipeline, and I think there's hope in spite of all this. We appreciate what Kidney Foundation it continues to do for our patients in terms of support, getting to the hospital and getting to dialysis centers and providing meals and things like that. It becomes even more critical even during this time. So we continue to be thankful for that.